All right. So hi everyone. My name is Kirby Fye. I'm with the department. I'm listed as Amy Holland if you've joined via WebEx. It looks like we have 17 participants on the call. I just have a few housekeeping things. Welcome to the Region 7 Planning and Policy Council meeting. I guess this is what, our fourth meeting virtually? I can't believe that. Is it our fourth? I think
I think
so.
so. Yeah.
So we're all pros now, right? Anyway, I just wanted to welcome you all. Thank you for taking the time out of your day to join the meeting and being patient with technology. Just a few things to go over. Per Governor Lee's Executive Order 71, the meeting will be recorded and it will be posted to the department website within the next day or two, probably tomorrow. With that being said, please state your name before you have any questions or comments. It just helps with the purposes of the minutes. And also, please be sure your phone or your computer is muted if you're not speaking. Otherwise, we'll get a whole lot of feedback when coming through. I'm going to go ahead and read through the list of attendees that I have here. It looks like everybody's joined via WebEx. Go through the list of attendees. We can always touch base again at the end if we see anyone's joined in the middle of the call. And then I'll hand it over to you all. So like I said, this is Kirby Fye with the department. I have Allison White, Ashley Knott, Avis Easley, also with the department, Bartholomew Allen, Butch Odom. Let me see, Jacardis. Can you say your last name, Jacardis?
It's a Suggs.
Thank you, Jacardis Suggs, Kevin Spratlin, Cooper or Cal Bryant, Lincoln Kaufman, Lindsay Blevins, Marta Hernandez Fontenot, Barry Neal, Monique Moore, Pretoria Griffin, Susan Bell, and Tom Starling. I hope I pronounced everyone's name correctly. All right, I'll go ahead and hand it over to you all.
All right. Sorry, everybody. I had some technical difficulties earlier. So I'm assuming everyone got the email from Butch. And initially we did have a speaker, but due to some complications, and it's probably for the best, she won't be able to attend this meeting. And the reasons are a little bit personal, but what we will do is we're going to use this meeting to go over our needs assessment. And that is probably going to take the bulk of the meeting time. If everyone has the agenda that Mr. Butch sent out, we'll kind of start there and kind of work our way through. I'm pulling it up now. Give me 1 second. This technology over here sucks. Excuse my language. All right. So, once again, my name is Bartholomew. Pretty much everyone has introduced themselves. If you had a chance, we're going to go over the minutes that were sent on by Mr. Butch. Hopefully everyone has had a chance to review them. If not, we'll take a couple of minutes now to kind of go look over them, and then we'll get an approval of the minutes. So if we open your minutes up, let's look at them now if you haven't done so. All right, I'm assuming everyone has probably had a chance to either review them, look at them over. Can we get a motion to approve the minutes?
I approve the minutes, Mary Neal.
Can we get a second from the floor?
It's Lindsay. I'll second.
Hey, Lindsay. All right. Got an approval by Lindsay and a motion made by Miss Mary. All right. So, with that being said, Kirby, do you have any updates you'd like to provide us?
Sure. Give me 1 second. Pull it up.
Of course you do.
I always have an update.
Oh, you always have an update.
All right, just a few updates since we last met in October. Butch, as always, I will email this to you and you can copy and paste it and put it into your minutes. There's a few links in here too. The department is receiving a new federal grant to expand criminal justice alternatives for Tennesseans living with addiction. The $6 million grant from, of course, my phone's ringing. Probably somebody wanting to consolidate loans, student loans.
Yes.
Okay. I get like 8 of those calls a day. Okay. The $6 million grant from the U.S. Department of Justice will cover 10 project sites, including Anderson, Blount, Bradley, Cheatham, Cock, Dixon, Grundy, Montgomery, Roane, and Tipton counties. Services under the grant begin with a collaborative community review of services under a standardized model called Sequential Intercept Modeling, otherwise known as SIMS. The county-specific report is then used to prioritize needs and make decisions about spending additional funding. The new grant builds on a previous $6.5 million grant from the Department of Justice that is already serving 11 Tennessee counties. 5 of the project sites chosen for this new grant inquired about services and expressed interest after hearing about the successes of the locations in the first grant. The strategies employed by SIMS include law enforcement and other first responder diversion programs for people experiencing substance use, embedding social services with law enforcement in order to rapidly respond to drug overdoses, and evidence-based treatment such as MAT, as well as recovery support services, including transitional or recovery housing and peer recovery support services. In December, the department and the Tennessee Department of Health kicked off a new campaign centered around the risk of drug overdose and suicide during the winter holidays. The campaign, called Resilient Tennessee, focuses on building resilience and strengthening community connections to prevent the tragic loss of life to overdose and suicide. Behavioral health experts worry the climate around COVID-19 may worsen the rise in overdoses traditionally associated with winter holidays and could result in increased deaths from suicide. Through media messaging around overdose and suicide prevention, social media outreach, and virtual trainings, the Resilient Tennessee campaign seeks to empower Tennesseans with the tools and knowledge to overcome the personal challenges they face, watch out for and help those around them, and emerge on the other side stronger than ever. For more information about this, including a calendar of events and other resources available, please visit www.tntogether.com. The department is receiving a new federal grant to expand the system of care across Tennessee network. The 4-year, $12 million grant from SAMHSA expands SOCAT services to 13 new rural counties for service availability in all 95 counties. The new grant will build upon lessons learned throughout 2 decades of system of care implementation in Tennessee communities. Over the past 3 years, SOCAT teams across the state, utilizing high-fidelity wraparound services, have been able to maintain a 90% success rate of keeping children, youth, and young adults in their homes and within their communities. In the application, department grant writers focused on rural and distressed areas of the state. Counties receiving services under this grant include Bledsoe, Clay, Fentress, Grundy, Hancock, Hardeman, Jackson, Lake, McNairy, Morgan, Perry, Scott, and Wayne counties. And the behavioral health agency partners include Frontier Health, Helen Ross McNabb Center, Mental Health Cooperative, Pathways Behavioral Health, Professional Care Services, Tennessee Voices, and Volunteer Behavioral Health Care Services. The FY20 Joint Annual Report is complete and has been posted to the department website. I've included the link to that. I suggest you all, or encourage you all, to take a look at it when you can. It just highlights a lot of the accomplishments, not just within the department, but within the regional and statewide planning and policy councils as well. The 2021 needs assessment, which we're going to be talking about today, worksheets should be completed and submitted back to the department via email to me on or before April 15th, 2021. So that's a 2-week extension. Typically it's due April 1st. So this year it'll be due April 15th. Please make sure to include data to support your region's identified needs. I've also included a link to the Fast Facts portal, which is available on the department website. As always, it's just a tool. You're not required to use the Fast Facts portal. It's just to help you along. If you have data from anywhere else, by all means, you can absolutely use that data. And last but not least, the department's pleased to announce the release of the FY21 Creating Affordable Housing Announcement of Funding. The department is seeking proposals from agencies and organizations throughout the state to develop new, safe, quality, and affordable permanent housing options for people experiencing mental illness, substance use disorders, including opioid use disorder, and/or co-occurring disorder. An additional focus on this funding is for individuals ready for discharge from the regional mental health institutes, including those who are uninsured. Completed proposals are due by February 5th, 2021. I've also included a link to access even more details and information about applying for this funding. And I do believe I want to say this is something that has appeared on the needs assessment in the past. I'm not sure if it was specifically in Region 7, but I know this is an area that has been included on the needs assessments in the past, specifically for individuals being discharged from regional mental health institutes who are not insured and have nowhere to go. So that's really exciting. And those are the updates I have right now.
Thank you, Kirby. I appreciate it. Is there anyone else from the state that might want to speak or have any updates in addition to Kirby's? Okay. Well, first let me start off by apologizing. I in the chaos of 2020, I failed to update and keep everyone abreast as it pertains to our different committees. Luckily, I got a great team in Mary and Butch, and Mary sent out an email kind of confirming those individuals if they will still be responsible and would like to chair the certain committees. Those committees being the adult mental health, the substance abuse, and the children committees, with Allison, Lincoln, and Lindsay, who are actually on the call. All of them confirmed in the positive. Am I right? Yep. Okay, great. So once again, I do apologize, but I thank you for definitely stepping up. It's a big, big win for us. I also have to apologize because Butch gave me some homework and I didn't do my homework. Pretty much I was supposed to be reviewing, I think it was Region 3 or Region 4, Butch, listening to their notes to see how they actually did their breakout groups and how they did their needs assessments via WebEx this year. Kirby, I will defer to you if you have any suggestions on how maybe other regions have done it.
Sure.
What we think we could do may not be the best way. So if you have any ideas, step in, please.
Sure. I know we have to get a little bit creative working on the needs assessment virtually. You know, WebEx, we do have the option for breakout sessions, but it's not really doable because you need to be able to record and have it posted. So it just kind of makes it a mess. So I will say, Region 4 specifically, just because it's on the top of my mind, they looked at the needs from last year. Region 6 did this as well. Looked at the needs from last year and kind of went step by step. Is this something that is still a need within our region? Is this something that maybe the department is working on? It might not be, you know, the department might not be able to address the need in its entirety, but they might be able to take bits and pieces of a certain need and slowly work towards that goal. So they went through each need by need, and then they would reach out to, you know, their adult committee for suggestions and just kind of do it like step by step. They had an outside person that's specialized in running meetings like this come in. I know that's not always an opportunity for everyone. So she was there to just kind of help guide it along, but wasn't a member of the council and was just kind of there to help guide, which I don't mind to help guide if we need. But I think that's where it really starts, is looking at each of your needs from last year, which I have available if you need me to pull those up on a shared document. And just seeing where that's at. And if it's a need that's still there, even if it's a need that's been on there for a couple of years in a row, if it's still a need, I would keep it. If just, you just want to make sure the data is updated to reflect more recent years. You don't want to keep everything verbatim. Or you might look at a need and say, hey, part of this need has been addressed, but this other part is still here. Or maybe we need to reword this need so that it's more likely to be implemented in the 3-year plan. I hope that helps. I feel like I was just rambling.
No. In fact, it does. And some of the members, along with Butch and Mary, we've been brainstorming. Butch, after I let Miss Kirby, if you don't mind, Kirby, kind of going over the needs we submitted last year. Butch has some ideas that he kind of sent and some things he thought about, along with some things that we just kind of been throwing around. Butch, if you want to, after Kirby kind of goes over the assessments and the needs that we had from last year, if you want to kind of highlight some of your ideals, and then we can kind of, like Kirby suggested, kind of just go right down the list of kind of brainstorming some ideas and some of the needs that we actually need, or even determining if the ones that we submitted that may not have made it to final approval state, if we need to kind of resubmit those. So, Ms. Kirby, if you don't mind, can you go over our needs that we submitted last year?
Sure. And one last thing I forgot, they this was a meeting that Region 4 held in October. They usually get started on it they usually use 2 meetings to narrow down their needs assessments. Not required. That's how they function. But another thing they do is you don't need to have all 4 needs finalized today. You might have 12 needs today. And what they do is they send out kind of like a survey to their members who can vote on which needs they feel need to be identified within their region. And then they go from there. So you don't have to have all 4 needs identified today. You have time. So I just want to throw that out there.
That sounds good.
Let me pull up last year's needs.
I have a question, Kirby.
Yes.
You passed broken apart and we wrote in, 3 different groups. There's never really been a lot for children and adolescents, but children and adolescents kind of break apart and do a group to talk about the needs, and then we've got adult substance abuse and adult mental health. Right. And because you're saying that things need to be recorded, do we all have to have these conversations together without meeting separately? Is that what you're saying?
No, it's only just the regional council meetings need to be recorded. So when you split up and if you have a children's committee meeting later, that's not today, that doesn't have to be recorded.
No, I mean during this. So when we do needs assessment, we split up during the meeting and talk about the needs separately, and then kind of come back together. But with this platform, I'm not sure if that is doable.
Yeah, that's not doable, unfortunately.
Okay.
Yeah, unfortunately. So I think we'll just have to have all of the needs out there: children, adult, mental health, and substance abuse. And then you all will have to narrow that down later, however you decide to do that. Okay,
perfect. I just want to make sure I clarify that.
This is Avis. Another way that has been done in the past that has worked, you all may want to consider too, even before the needs assessment meeting, and this could be going forward, not necessarily today, I'm saying, because you didn't have that opportunity, but going forward, if you have a children's committee and a adult committee, which Bart just talked about, those being established, then you could meet prior to, if we're still meeting virtually, you can meet via Zoom or conference call. It doesn't even have to be a virtual conference call aside from this meeting, and give a couple of needs from the adult committee on the adult side and a couple of needs from the children's committee, or you can do one of both, one mental health, one substance abuse, however you want to split it up. But those committees could essentially develop those needs and then bring it back to the larger group and have those needs already kind of established for the larger group to talk about. And again, this is something going forward. It wouldn't apply to today since we're already meeting, but just some food for thought for next time. That's another way I've seen the regions do it before that's worked very well.
That sounds good. Thank you, Avis. I appreciate it.
Can everyone see this document I shared?
Yes.
Okay.
Yes.
Yep, see it. If you're talking, I can't hear you, Kirby.
Do you want me to go through each of the needs?
Yeah, if you don't mind.
Okay.
You don't have to go through the data or anything.
Okay. So mental health need number 1, increase the number of transitional housing beds for families in order to decrease the wait time in emergency shelters and keep families from being separated. 2, let me see, I have this blocking. Increase supports for lesbian, gay, bisexual, transgender, and queer or LGBTQ youth to include services with a focus on housing and wraparound supports with a focus on suicide prevention, harm reduction, and peer support. Establish substance abuse prevention programs within Shelby County schools. Increase the number of medical detox beds not associated with private insurance-based or MAT programs.
Okay, that sounds good. Thank you, Kirby. So, based off of what we have and what we submitted on last year, I guess we can just kind of chime in. Do we feel that these are still a need? Do we feel like we need to still kind of go over each one? Do you want to add to it? I know a lot of people have had their own opinion of some additional things that we can actually use as some additional needs that we need in Shelby County. How do you guys feel? You want to kind of go one by one with the mental health?
Hi,
Kirby,
Bart. This is Jakarta.
Hey, Jakarta.
So the first one, to increase the number of transitional housing beds for families, that is definitely something that we need.
All right. So, how does everyone else feel about that?
I second that. This is Monique.
Hey, Monique, how's it going?
Good.
All right. Anybody else?
This is Marta. I second that.
All right. So it says increase the number of transitional beds, housing beds for families in order to decrease the wait time in emergency shelters and keep families from being separated. I'm 100,000% okay with that. Is anyone opposed to keeping that? And I think the other thing we need to think about what kind of traction it gained on last year. Kirby, are you able to share some thoughts on if any of these were seen, or I'm sorry, not seen, but made it to maybe the second quote unquote phase?
So that information would be within the 3-year plan, and that's on the department website. I can't remember offhand because so many have been addressed. But if you look at the 3-year plan, which I don't mind forwarding you all the link if you need it after the meeting, I have made footnotes throughout the plan that states this was noted in the 2020 needs assessment. So for this information concerning transitional housing under mental health, I would absolutely look towards Division of Mental Health Services goals. It's all broken up by different divisions and offices to help you follow. I know, obviously, like I read earlier, the creating affordable housing, that for mental health and substance use disorder, with a focus on individuals without insurance being released from regional mental health institutes, things like that. There's several. So I would look specifically under mental health services for that information for the first need.
Okay, sounds good. I think we can do that.
Hey, Bart.
Yeah.
You mentioned the work that I did, and as a preamble, I only worked on it for about an hour, but part of what I was doing was looking at the wording of the document that Kirby's referring to and looking at the state priorities. So like if you read through it, and I just read the summary, I didn't go to the state website. There's clearly like an interest in increasing housing supports for people with mental health issues. What's not, and I think the more specific that we are in our need, the less it seems covered. So there is nothing that I saw that actually reaches out to LGBTQ youth. There is some interest in increasing the amount of mental health services available to students. For example, also, while there's, I think that Susan might want to talk to the detox beds in town. There's clearly, the state has clearly pivoted towards MAT in a lot of the new efforts as it relates to, substance use disorder. There's still just, and part of that just reflects all the money that's coming in. But I think so like Lindsay, where we say establish substance abuse prevention programs within Shelby County schools, the state summary of their data, of their emphasis is to increase mental health services to students in Tennessee schools. So some of us think, I put substance abuse under that behavioral health, that mental health rubric, but that's not always what you want to do. So I think I don't want to sound like I'm just blabbing around here. I think that but for example, if we really think that substance abuse prevention is what's needed within Shelby County schools, we should keep that language and not just accept increasing behavioral health access to children in schools in Tennessee. Okay,
I'm sorry, go ahead. No, I'm just wondering are you saying that we should be more specific in how we word our needs so that they can be tailored more towards Shelby County for that, or?
Well, I guess what I was saying is that, I think it looks like if we really believe that if what we want is something specific related to LGBTQ, then we need to leave that language. There's language about increasing supports for youth. There's language about, suicide prevention and some of that kind of stuff, but there's nothing in there that pulls out that population of youth specifically. So if that's really what we want, then I think we need to leave that kind of language. Again, the state, there wasn't anything that I saw that, I think there were things about community mental health centers and something that you could interpret as increasing detox beds, but it's MAT, lifeline, ropes. It's really all about directing people primarily to MAT. You think that's fair, Kirby? I
mean, I agree with, a lot. You have to look at where the funding's coming from and what it's focusing on, which right now it's MAT. But that's not it entirely. I would kind of, if it's something that, if for example, for increasing supports for LGBTQ, if that's something specifically you want, I wouldn't remove that just because it wasn't identified in this 3-year plan. Because if it's still a need there, it's still a need. But what I would suggest is if you see, you're likely not going to see something specific to a certain county within the plan. It's going to be like a statewide program. And in that case, I would either look at the Fast Facts portal, which oftentimes breaks things apart by counties and regions to see what's being addressed, or I would reach out to whoever is over that office or division to see if they can provide you with more information on how that prevention program, for example, is being utilized within Shelby County, or does the mental health prevention, is that inclusive of substance abuse too? Because it might not be clear in the 3-year plan. I would reach out for clarification first.
Okay.
I would like to say that and Kirby, correct me if I'm wrong, but on the 13th of January, we had the adult committee meeting. And when it comes to transitional housing, and this is the statewide committee meeting, the committee agreed that there was still a very high need for transitional housing. And that was
Right.
the statewide. So it looks like it's not just a Region 7 issue. So I definitely think that that's something that we could continue to have on our needs assessment.
For sure. And I also put together, along with the needs assessment summary, I also put together a 1-page list of multiple needs. And it lists any need that's been identified by 2 or more regions or statewide committees. And transitional housing has been on there for years. It's going to be an ongoing need, even when it's being addressed. I'm sure it's still going to be a need because the population, so I know for sure transitional housing is on there.
So how about we do this? Because it looks like we'll be doing this for another session. Let's go through the ones that we have right now, and then how about we kind of let everyone add whatever need they think that we still haven't addressed from last year, and then we at least have a starting point with all the needs, and we can kind of vote for the ones towards the end, maybe in another session, on the ones that we want to keep. So can we at least say that maybe the 4 that we have in front of us, those are still possible needs that still need to be addressed in some shape, form, or fashion? Is that safe? And once again, those needs are, for the second, we already did the first one. The second one is increased supports for lesbian, gay, bisexual, transgender, and queer youth to include services with a focus on housing and wraparound supports, with a focus on suicide prevention, harm reduction, and peer support. And then on the substance abuse, the first need was to establish substance abuse prevention programs within Shelby County schools. And the second one is to increase the number of medical detox beds not associated with private insurance-based or MAT programs. Can we say that for right now, those needs, maybe something we may want to continue or do a little bit more work or research on, and then add to whatever assessments to whatever needs that may not have been addressed from last year?
So I'll say for child adolescent, and listening to what Kirby has to say, I know we very specifically targeted, the LGBTQ population last year when we were talking about children and adolescent. That may not be, because it is so specific, might not be something that the state specifically targets, that we might want to focus on something else or be a little bit more broad in how we're describing it. The other thing that I've noticed, and it hasn't necessarily changed this year, it's kind of year after year, is the need for really a connection somehow between law enforcement and the mental health needs. We've got with, Alliance, a walk-in center, MOU contract really with, law enforcement to drop off if there's consumers. There's a lot of money being targeted, like with the care teams and things like that, when you've got high utilizers with 911, when there's mental health concerns. There's jail diversion programs. There's a lot of stuff that we're talking about for adults, but for the kids, it's really hard for them to access services. The bulk of the kids who are getting picked up by law enforcement in the community come to us, and they're not all needing hospitalization, so they're able to get, we can assess them obviously and make referrals to treatment, but I feel like there's somewhat of a disconnect. I was really hoping, we had met with Shelby County government. This is before I came to Lakeside. So I would say 5-ish years ago. And really we're talking about, a place that the community was supporting, that Shelby County was supporting for like a referral center. I forget what we called it. And Susan, if Susan's still on, I lost a lot of people's pictures when we started sharing screens, but I want to say, you know, Alliance is a part of it, and there were some other people, you know, youth villages.
Was it the Youth Advocacy Center? Youth Advocacy Center?
Advocacy. It was like Youth Assessment and Referral, like a YARC. I mean, I can't remember what we called it, but there was a lot of talk, and I just feel like right now it's either, you know, you get picked up for something and, oh, go to Lakeside, you know, it's a mental health thing. Well, you don't need to be in the hospital, you know, for some of these things, but you do need quicker access to, you know, to resources and things like that. And, you know, if you've got TennCare, great, you know, we can get you hooked up with, you know, CCFT and other things. But I just feel like it'd be beneficial for us to have some conversations around how we really are, you know, targeting some of these youth who need, you know, some higher levels of care than just traditional outpatient. And I know, and you might know more than I do if there's grant money that's coming out or things that y'all have on the children end versus the adult end. But if there isn't, I just think that might be something that we want to talk about.
I think that they did start something through, like section with UT, Child Safe, and Dr. Stewart, and it was
Susan,
yeah.
you're cutting out a little bit. Maybe it's just me.
Is it better?
Yes.
Okay. I'm turning the picture off because I've got the computer way up in my face, so the audio comes through better. There was Dr. Stewart from UT, Child and Adolescent Life, was involved with something similar, if not what you're talking about.
It is exactly what I'm talking about. They transitioned it over to Center for Justice Involved Youth, but I hadn't heard much of it after.
I think it kind of went kaput because they surely might have ran out of grant money. And I know that we had some involvement by offering free assessments to that for a while, but there was a whole bunch of issues, like they didn't really want the police to drop them off there. They wanted it to be a more volunteer, and it just didn't go. And I don't think it's still in existence. Somebody else may know. I know.
I think it might be because I'm on a committee with someone from that.
Yeah.
I'll look into it, but I'm going to pull up an email that I have. But I think it might still be going, or at least the program.
Yeah, if it is, it's not what it was initially intended for. And I don't know if I'm assuming, again, you shouldn't assume things, but I'm sure it has a lot to do with what you're talking about, money, right? Who has the money? And I know Shelby County was backing it for a while. Dorcas Young was the kind of the facilitator or project coordinator for that. And then she is now director for community services, might be her title. So she shifted to something else. And then, you know, there wasn't as much of a backing to get the program off the ground. And then it, like you said, Dr. Stewart took some stuff on, but I just think that there's room for us maybe to look at that. I think it's important, but I wanted to throw that on the table.
No, that's good. That's good, Lindsay. And I just want to, maybe I want to clarify something, or maybe I want to say something. I'm not exactly sure, but I'll put it like this. And I heard everything that Kirby said and everyone else, but, and please correct me if I'm wrong. To me, the needs assessment in its totality is to address the needs of whatever that region is. And that region may have something that all the other regions may not have. I mean, for example, if we're having an issue with the LGBTQ and their supports in Shelby County, everyone may not be having those issues, but the professionals in Shelby County see that and they need assistance in trying to combat whatever those things are. And so I'm saying that to say that if in the event that it's about our wording, as far as what the entire state may need, I understand doing the research to see if it's been out there, but sometimes it may be just Shelby County that may be needing these things. I definitely think we need to do our research and find out, but I just want to make sure that I don't know how we should be wording certain things so that it can get on the front line to be addressed, maybe outside of this 3 year, maybe the next 3 years. But I just kind of want to put that out there. Like, for example, I personally think, and this could be across the state, I personally think there needs to be a look at mental health in minority populations, primarily African American and Hispanic, as it pertains to maybe creating some type of minority mental health under the Department of Mental Health and Substance Abuse that addresses those things, especially when you see the rise of mental health issues in African American children. That may be specific to Shelby County, and I just want to, be able to say those things. Lindsay, you mentioned the children and law enforcement. I don't know if everyone is having that issue, but you're 100% right. So maybe it is how we craft our needs so that it can kind of make moves. Because, and this isn't any knock on anyone, I just want to make sure Region 7 is represented well, and I want to make sure that we actually make change. And I'm not saying we haven't made any change, by no means, but let's be real. Memphis, Shelby County, we got a lot of issues that needs to be addressed. And we have a large minority populations. We have a large youth population. There are things that we have to do a little bit better. And if that means crafting our wording to get on the front page of some stuff, then I say we do that now. But what I am doing, Lindsay, I'm adding that. I'm just taking notes. It's kind of hard not to have the little breakout session and have the little sticky pads, but I'm adding what you just said, Lindsay, to what we already have. And anybody else who wants to kind of chime in, throw something out there, I'm just going to start listing the needs.
Bart?
And we'll build a database. Yeah.
Go ahead.
Hey, Bart, this is Kevin Stradler with the department. I wholeheartedly agree with what you're saying.
I appreciate
that we really need to be focusing on the people that we're serving in our communities. You said that very well, and I hope this group will consider your words there. Very, very important. I'll add to that. Would like our region to look at how we could minimize law enforcement interaction in many of these cases. I think that's something that we should all be thinking about. Our CIT model is very strong and very important and is groundbreaking, but we still have a strong dependence upon armed police officers to be first responders on mental health.
And I want to echo off that too. This is Monique Moore, something that Bart and Kevin have both spoken about, and the young lady prior to Bart. But I was most interested in, just want to throw out that the culture surrounding, like I said, the police department and the CIT division, where it may be officer involved shootings and interactions, not only with the youth, but also adults of all races, but especially with our Black and Brown community. And we know Memphis is fully, we have a lot of African Americans in this community. And I think if nothing else, it's about being proactive. If it's not even something that our research may be showing, but we know it's there.
And I also think, and I apologize if I'm taking up too much time, everyone, but I also think that we have to advocate for us a little bit better. And I'm speaking more towards me, but if we see something that needs to be pushed out, like, we need to start pushing it a little bit harder, whether that is several emails to the higher ups, whether that is several conversations. Kirby mentioned actually calling that department and having those conversations or emails. I think that we should be doing that. And I think we probably should be flooding their offices. And I apologize anyone on the state if I say flooding your emails or your phone calls, but I think that to be perfectly honest, and I'm just saying this, Memphis is Tennessee to me. Memphis is Tennessee. Shelby County is Tennessee to me. And I think that all the needs, we just need to make sure that we're pushing them out. So if there's an issue with the youth, then we need to be a little bit more proactive in making it happen. And that starts with me. That starts with all of us on these different committees. So, Kevin, if you don't mind, can you kind of rephrase what you would like to see happen? I want to make sure I kind of write it down as accurately as possible.
Sure. So there are several ways I could approach this. So I had not planned on speaking at this meeting. So let me say that on the front. What I would say first is all the healthcare emergencies that occur in our community, the only one for which we send a police officer instead of a medical person is behavioral health. I just can't wrap my head around that after having been in this field for 28 years. It doesn't make sense to me that when someone is having a behavioral health emergency, instead of sending one specifically trained to deal with that, we send an armed law enforcement member. And I think that's something that we need to consider. How can we do that better? And the reason I was talking about this is a couple of you were speaking on the needs of our youth. And I don't like the idea of, in many cases, we're criminalizing a behavior that could be better handled some other way, directing them into resources. So what I'm getting at is I would really like the state support in how can we build, whether we want to call them co-responder models or multidisciplinary teams, or I could come up with different ways of approaching it, that are geared toward better serving the community in a fashion that more holistically cares people without having someone with guns show up and try to handle things. Not very succinct, but that's what I'm thinking about.
No, it's good. So are you saying, like, instead of a CIT officer with a gun, maybe a fireman with no gun, or maybe a whole nother division of someone going after?
Social workers?
It could be any number of those things, to be frank. I mean, we need to look at what it takes to best evaluate this person's condition. So the social work piece is very important, and I'm a huge fan of social work. I think the EMS perspective, and I'm very biased as a paramedic, but looking at that medical piece, which can be traumatic in their own ways. Yes, I think that we should closely look at what is the proper responder to these situations, and can we model that in the Memphis area and scale it throughout the state.
Okay, I got it down.
Kevin.
Anyone else?
This is Marta Hernandez.
Hey,
Kevin,
Marta.
I agree with you 100% with what you were saying. Also, I think that is important that when people call in into the 911, that they are specific that the person is having a mental health situation. A lot of times, people neglect to tell the 911 that this is actually youth or a child that has a mental health situation. That's why maybe, I could be wrong, they send the person or the police officer with the arm, the professional that is not as well trained in mental health. And I think so I believe that we have to implement something to kind of educate more the people that have family members that have a mental health condition, so that when they call, they specify, hey, this is a person with a mental health condition, and I need to send a CIT officer or someone who is prepared to deal with this situation.
Yes, and I'll just remind everyone the 988 phone number will be rolling out in not too long of a period. And I brought it up on call. Some of you have also been on that. We as a community, I believe, need to be prepared for an increase in calls and need to have an intervention that is geared towards being available to those who contact that number. It's going to get busy. I firmly believe that. Once people have to memorize a 1-800 number to call and can dial 3-digit number, 988, it's going to get busy. We have time to get rid of it now.
Thank you, Kevin. I appreciate it. Anyone else? Throw them out. I mean, this is great. Tell me what you want. We can start writing them down. Don't be shy.
This is Susan with Alliance. You know, I know we're jumping around here on our various needs, but I just want to share that we've seen no increase in indigent beds for medical detox. And last week there were 200 people on the waiting list, which is, you know, we're going to lose
Definitely need
most of them.
So I'm sorry, I'm looking at it right now. So we definitely need to keep the increased number of medical detox beds need. Is that what you're saying?
Well, Yeah, I would. I mean, I'm saying it. I don't know. The group needs to agree on it, but
No, that's all right.
yeah.
Anybody else want to chime in? I mean, and once again, I don't think there's anything wrong. There's no wrong answer, Susan. If you're seeing that, there's a good chance that you're not the only one seeing it. It may be your field is a little bit more tailored towards the detox beds. Like for example, I don't see detox beds as a psychosocial rehabilitation. That's not saying that we don't need it. So that's why we have such a diverse group of people. So anyone
Right.
else feel like that?
I definitely agree. There's a need out there. We see people all the time who need detox, and we're referring them to Alliance and, or other resources as well, but it's just adding to, the wait list.
Well, you're referring the uninsured to us. I mean, there are maybe more resources for people who have insurance.
Correct.
So that 200 is not an insured group. That's an uninsured group.
Correct.
And,
Wow.
I mean, there's a lot of money that's been thrown into the opiate crisis and MAT, but I think most people would say that for some individuals, detox is the necessary first step. And to get to a MAT program or to, get in recovery. That is not a drug that people easily stop using.
I agree. I totally agree, Susan. All right, so right now we have the 4 that we kind of submitted last year, and then I've added 3 additional needs from those who have spoken. Does anybody else have a need they want to throw out there?
I have a question.
Yeah.
What about, okay, we are in need of detox bags, but what about when the person is detox but they need more time to continue with the recovery? Sometimes they go back to the same condition that they were before or the same family that they went before, and it's kind of hard for them to continue with the recovery. I believe that that's also a need, like a transition places for people who are trying to recover from substance abuse.
Susan, can you speak to that a little bit more?
Well, I have people. I'm sorry. Go ahead.
No, that's okay. What I don't know if you're saying this, Marta, but certainly a good many people who go through detox need a higher level of care than, say, an outpatient MAT program. And we're referring those to the various alcohol and drugs, state-funded residential centers. I don't know how much trouble we're having getting people in to, say, a 28-day program. But is that the level of care you're talking about, Marta?
Well, I listened to Dr. Floyd one time said that a person to be able to recover completely from a substance abuse issue, they need at least 3 to 6 months. And so 28 days is okay for detoxing, but I think the problem that I'm facing or that I'm hearing from people that I know is that after the 28-day program, they are put away into the same environment that they had before. And therefore, sometimes they go back to the lifestyle and the drugs and the addictions that they had before. So I was talking more about a transition place where from the 28-day detox, they can go to another place to kind of complete the recovery. That's what I was talking about.
Sober living place, somewhere where, not back on the streets where their drug dealer is. Absolutely, that's a need. If we could just get more housing, I think that, that might address some of it. Our need here says transitional housing, which is interesting because I don't think anyone has funded transitional housing in a long time. It's permanent housing. And I think there's a need for transitional. I'm glad it's on there. The other thing, Marta, is I think that the MAT programs, the buprenorphine, Vivitrol, the hope is that if an individual can get off the drug and get onto one of those medications, then, IOP, they can go to an intensive outpatient program, or hopefully they'll be successful. I don't think you won't get 200 transitional housing spots. That's my input in it. It takes everything. It's just this group narrowing down what they think is most critical for the individuals.
Right. Okay. Marta, I've tried to sum it up as best I could for your need or one of the needs that you think. Anybody else? And once again, just to give everyone clarity, what we're doing is we're writing down all of our needs in conjunction with the ones that we submitted last year. We're writing down the additional needs, and then we can kind of from there either set up another meeting to kind of narrow down these needs even more and start putting them in the categories, and then hopefully that meeting is the meeting that will have a finalized version. So feel free to throw your needs out there. We'll sooner or later we'll whittle them down to just the 4 that we need. As I stated earlier, one of the needs that I kind of wanted to focus on or address, and I'm not exactly sure if I know the wording of how to do it, but as I stated, there is definitely an increase in mental health issues in the Hispanic and the African American community. What those look like a little bit different for both populations. If you know the history of mental health in those different communities, the Hispanic population, much like the African American community, were focused more towards a pray it away approach. You go to church and you pray away quote unquote demons. I think over the years that's probably been detrimental to both communities. And it wasn't until maybe in the past couple of years that we've kind of started refocusing or addressing mental health in the African American community and in the Hispanic population. What I would like to see, and I think this may kind of help cover some of the things that Lindsay, I apologize, y'all, may have stated earlier. Some type of a governing body that allows that targets those two populations or minority population under the Department of Mental Health and Substance Abuse. To give you an example, the health departments across the country, they pretty much at some point they realized that there is a stark contrast between the health of a population in its totality and then the minority population. So they developed minority health. And then that became a focus. I would like to see minority mental health outside of minority health be just a focus for Tennessee. And I haven't seen too many minority health programs in its totality. So I would like to see something like that. I think that's a need across the state to develop some type of office that kind of focuses strictly on that. What do y'all think?
Can I ring in, Bart?
Of course. Go ahead, Lincoln.
I agree with what you're saying 100%. I saw recently that something in the Memphian, the Daily Memphian, about an alliance 45,000 square foot crisis assessment center on Summer in the works, supposedly. So that's going to include detox beds. In my experience, there has been a huge shift in the referrals I make on the Red Line and community referrals to MAT instead of Alliance. Up about 4 or 5 months ago, it was a lot more difficult to get anyone into Alliance, and like Susan mentioned, there's the waiting list for non-insured patients is just out of control. Having to send some of those, if I can, to Pathways in Jackson or Milan, but what we were talking about last year, what John Jackson and the group and the adult substance abuse group was coming up with was this kind of safety net idea that, I think could kind of like what you're talking about might even fit in with this, was like a facility or a way to fill in the gap in between the actual crisis call and finding a place for these people, like having some sort of facility or some sort of service to take to, whether it be peer support, maybe like a clinician or a small group of clinicians, but some sort of service to just fill in that gap in between the them being able to even get into a detox bed, or even, getting them into, like, as far as the opioid epidemic and getting them into the state opioid response program. There's not much of a gap there that I'm aware of, but there's like a huge influx of use in methamphetamines, and the other drugs are doing what they've always done, so like it was really like this idea for the safety net service that includes peer support and clinical help for people that are just kind of stuck in that gap in between crisis and care. And that was really the idea, just to start kind of trying to brainstorm a solution there, which could include especially like a unit specifically for minorities. I know with the CPRSs and stuff like that, there's a lot of people looking for volunteer work, looking for jobs, and I think that would definitely fit into that category. I don't know how helpful this is, what I'm saying in the context, but that was kind of the original idea that we were talking about in my group.
No, that's good, Lincoln. Can you kind of sum up what you were saying in a statement of what you would like to see happen or need?
Well, I'm reading that bottom need where it says data. It says need for a safety net solution for both addiction and mental health, and the solution that we were discussing was a service and a facility to fill in that gap, like a walk-in service, like a stop-in and call center, with a volunteer staff and a small clinical staff.
Okay, so walk-in call center. All right. Great, thanks, Lincoln. I appreciate it. Anyone else? All right, so I have one last one. And I promise you guys, I'll be quiet because I know you're probably tired of me. So I don't know if you guys remember. Oh my gosh, I had his name on the tip of my tongue. He used to work with Blue Care. He had a ponytail. Was his name Ron? Was it Ron?
Ron Martin?
Ron, yeah, that's it.
Ron.
Who?
Ron, R-O-N.
Ron, yeah. So Ron, some years ago, and it's always been on my mind when we have these meetings. Ron, some years ago, and correct me if I'm wrong if anyone knows this, he spoke on the fact that his brother or someone died who had a mental illness. They actually walked away, and they weren't found in time. I can't recall. However, over the years, at the time, Ron was actually working on trying to get something passed, some like an Amber Alert for individuals with mental illness. In some other states, they have a Silver Alert for older individuals, um, but pretty much as you already know, as the Amber Alert goes out, everyone's phone gets pinged, and they're looking for a person. I know that over the years, I've heard this time and time again, and I don't know all the research. I don't even know if the state of Tennessee has something like this. But what would be nice if there was some type of alert system that we could implement. I think we have a Silver Alert here in Tennessee, but maybe some type of alert system that can be kind of piggybacked in on the Silver Alert for individuals with mental illness and substance abuse who have gone missing or have walked away for whatever reason, that everyone can kind of be on the lookout for. I think that would be a nice need or something that we could actually possibly address.
Yeah, because all I see now is like, when you're watching the news, it's like the city alert or something like that. And they'll say, I've seen several where, this child has autism, right? They can't speak, they've walked away, and things of that nature. So it's definitely not as formal as what you're talking about, where your phone gets pinged and everyone's aware. And, obviously not everyone's watching the news at the same time. So it's the only way you're gathering some of that stuff. So it'd be interesting to see if there's any other states who are doing something similar.
I think I'm not, and it's been a couple of years, but I think I want to say Kentucky, and I'm probably wrong, but they have where if an elderly person goes missing, then they send an alert out, and then if someone has a mental health issue, they have in the past an alert out. I don't know if it's one of their practices, but they kind of use that same platform. Once again, I could be totally wrong on the state, but I was reading up on it at one time. I would like to see something like that in Tennessee. If we could tailor it for us to find those individuals a whole lot quicker, because I think research showed at the time I was reading that if you're not finding someone with a mental illness who has gone missing within 48 to 72 hours, there's a good chance that you won't find them alive. And that's just a little bit disheartening when we work with this population 24/7. So. All right,
Bart,
so yeah, go ahead, Butch.
I've been spending the last 10 minutes trying to figure out how to unmute myself today. You would think that I'd be an expert at unmuting. And is Susan Bell still on the call? I know she had one at 1 o'clock. I think one of the things, so to Bart's earlier thing about the minority communities, I know that most money for substance use that comes into Shelby County through the state has it written into it that it cannot be used on undocumented people. And I'm just wondering, is that something at the state level, Susan, do you know, or is that part of the federal pipeline? Who says we can't do that?
I mean, I don't know what the federal level says. I do know at the state level, none of our safety net dollars for mental health or substance abuse can be used for that population.
Yeah. I've assumed it's a state issue because the Department of Health doesn't have that same thing, but I don't want anybody from the Department of Health to go looking for that. But it is unfortunate that it really is unfortunate that I mean, the Hispanic population in Memphis is pretty small, but they were, with the pandemic, they were so outnumberedly represented by the people that were getting sick. It was just, we were having, for 7% of the population and 30% of the people we were testing positive early on. And so it's really hard to support that community in particular in ways that are really helpful.
The legislators have a lot to do with enough said about Tennessee.
I agree. All right, so if there aren't any more needs, and stop me if you have some more needs that weren't addressed. Right now, it looks like we're up to the 4 that we have to kind of go back over and review with in the addition of 1, 2, 3, 4, 5, 6, 7 more needs for a total of what's that 11 needs that we kind of need to kind of go over and narrow down to give you an idea of what those needs are. The 4 that were on the screen, and then we have, and forgive me if I did not summarize your need correctly. Feel free to jump in and correct me. We have the one that was presented by Lindsay to have some type of program or some type of engagement with the law enforcement and the youth and those youth that are having mental health crisis to not just be hospitalized, but to receive some maybe other type of treatment. Is that right, Lindsay? And I apologize. Yes. I know I didn't get it exactly how you said it. You said it so much better than me. But that was the one. Then we have, I think Kevin mentioned this one. This was the law enforcement and how law enforcement responds to individuals with mental health illnesses, not to have a cop on scene, but perhaps a trained mental health person that does not have a firearm to address the issue and to kind of go out to the different scenes. It would be nice to have a program where we can actually utilize that type of person. Is that right, Mr. Kevin? We'll come back to Mr. Kevin.
Talking to someone else, guys.
That's all right. Someone said something to me?
This was Susan, and
Hey, Susan.
I want Kevin's input. You know, we do have a mobile crisis for children and adults. However, some of these situations that you're talking about are too unsafe to send a master's level social worker into that arena. I mean, I think that's why then it wound up and it fell in the police hands. What Kevin and them are doing is they're taking a team out. And maybe it doesn't need to be the same team, Kevin, but I think we think that there needs to be some multidisciplinary.
So yeah, having a 3-member team is super helpful because you've got that protection piece in place with the officer. We've also got the medical covered by the medic, the paramedic, and the social worker there, the behavioral health piece. That multidisciplinary is very helpful, if that's what you're asking, yes. What I will say, though, is there are ways of doing this to minimize the police officer's role in that they don't have to be in a full patrol uniform. They'd be dressed down in something that's less intimidating. They can travel in vehicles such as ours that are not marked as the police department, even though we have all the safety pieces in place. There's a lot that can be to change this mission and get a little more palatable for the public, but safe for all concerned.
Well said.
All right.
For the record, I would say I'm never going to be in favor of sending one single person, whether that be a master's level assessor or one of my medics or anything like that. No one agency travels alone unless you're a chief like me, and we're dispensable. Everybody else is in pairs, and that's not a joke.
And I agree. I am not advocating, and never have I advocated one person going out. Definitely the safety of our people is priority. So I'm glad you cleared that up, Kevin. I appreciate it. All right. So then we have Kevin. Then we have the first responder. Marta mentioned this. Maybe this is more about training and phrasing it from a training perspective, either for the families or maybe the first responders who are answering the calls, but to make sure that when someone calls in using with a mental health issue, that they are clearly stating that the person that is having that issue, the person that is having that 911 emergency, they state to the responder that there is a mental health issue that is currently in place, or that the first responder asks if the crisis or the emergency involves someone living with a mental illness or substance abuse. Is that right, Marta?
So let me tell you all, when you call 911, you're asked a whole series of scripted questions to get to what in my field we'd call the chief complaint. What is the chief complaint? And as much demographics as we can get short of a patient's name or something like that. Now, I think police can even get names. So all of that you're asking for are already requested on the 911 call by the operators. However, I'll remind you, one reason that, for instance, my agency can't tell you exactly how many behavioral health calls we make each year is many of the behavioral health calls we go on do not originate as such. It's a person who will call in and say, I'm having chest pain, I'm having shortness of breath, I'm having abdominal pain, I'm pregnant, I'm having having that issue. And only after do we arrive on scene that we determine that it's a behavioral health issue. That happens very frequently. In fact, many of the calls that my care team goes on are referrals from field personnel who went on some other type of complaint, and when they get there, they realize this is actually a behavioral health call. So we do gather that information. Remember, it's only as reliable as the information provided by the caller.
So, Marta, with that being said, would you be okay for us to maybe not use this as a need or vote on this as a need, but just kind of educate ourselves a little bit more?
Yes.
Are you okay with that? All right, so I'm gonna strike that one. But it's a good point, Marta. I appreciate it. All right, so the next one we have was and I think this is Marta again, some type of, and I think Susan, correct me if I'm wrong, I think it was Susan and Marta, some type of sober living housing in addition to the outside of the 28-day detox, the bedding to have maybe a little bit more permanent 36-month housing. Is that right?
I think that's what Marta said, and she is right. I mean, there's definitely a need for transitional sober living for individuals.
All right. Then I have, I'm sorry, I'm just kind of taking notes. I mentioned some type of minority mental health group or department or office under the umbrella of the Tennessee Department of Mental Health and Substance Abuse. Yes or no? Do we feel like, do we just strike that, or do we combine it with something, or just take it off altogether?
Hey, so it's Lindsay. I'm going to have to hop off in a minute, but I wanted to add a couple of things. I mean, I think we need to also do a little bit of research too. So I think if we can find out, what is there a need? What does that look like? Or maybe we spend some research and looking at, is this something to pursue a little bit further? So I don't want to cross it off the list without us actually knowing what it is that we may be looking at. And so, I mean, I wanted to throw that in there. I hate to cross anything off the list before we actually get I
appreciate that.
Some backing behind it. So maybe we need to, and again, I have got this other meeting that's going to start now, but I want to spend some time doing some research on some of these things, getting some data in place, and maybe then we can send some information back out to the group, and that can be part of helping us decide what's the most urgent need that we have. Because I don't think we're going to have all the data today, but I think we need to have some bullet points underneath of some of the data. I mean, and not that I want us to waste our time doing a lot of data collection, but I do think it's important for us to be able to make some of these decisions.
You're 100% right, and I appreciate you. Thank you so much. So yeah, that's what we'll do. In the last two, walk-in center or some type of call center that pertains to the safety net. That's what Mr. Lincoln kind of threw out there, and then the need for some type of mental health alert. So what we'll do is, if everyone is okay with this, Butch, you can kind of help me out if I missed anything. I'll send this out to Butch for final approval, and so Butch can do his pretty touch on how he does his emails. And then see you later. Thanks, Lindsay. And then what we'll do is, if we can schedule a time maybe in the next couple of weeks or maybe even next month to meet again after we send the email out to address some of these things. The email will pretty much highlight all the different needs that we will be looking at, and then everyone who submitted a need, they can kind of start doing some homework on it, or any of the needs that you like, jump on it, do some homework on it, and bring that back to the table on our next meeting. How does that sound?
That's good.
Sounds good.
Yeah.
All right.
Sounds good.
So, I don't. If you can look at a calendar, I think this is probably the best time for us to pick a time to meet again. What does it look like for everyone? Do you want to keep it on a Tuesday? Maybe Tuesday in about 3 weeks, 2 weeks. The 9th is February 9th is a Tuesday. The 16th is a Tuesday, and the 23rd in February. I skipped the 2nd because I thought it was too soon, but I don't know. It's up to you guys.
My calendar says that the 23rd of February is World Spay Day. So I think we shouldn't meet on that day.
I don't think so either. All right, so the 23rd is out for everyone. Any other days? And it doesn't have to be a Tuesday. I was just trying to make it easy, so maybe you guys kind of keep with it.
On the serious side, the 16th is Mardi Gras.
This is Mardi Gras. Oh,
I think that's when TSPN meets too. So that may not work.
That's right.
All right. Draw some dates.
I'll say the 9th.
So we want to try Wednesday?
9th is statewide planning and policy council meeting.
Oh my gosh.
Are we talking about March or February?
What about March 2nd?
The 23rd doesn't have to be out.
Dang.
March 2nd is the next Tuesday.
Yeah, March 2nd. All right. Tell me some dates, everyone.
I was totally joking about the 23rd.
What about Thursdays? Anybody have any objections with Thursdays? I mean, not Thursdays. I'm sorry, Wednesdays.
Wednesdays are usually pretty bad for me.
Zakia mentioned a Monday. Zakia, the only reason why I didn't say Monday because I'm groggy and it looks like I need all my faculties dealing with you guys. You guys are good, so I got to be good too. So I'm a no for a Monday. But if everyone else wants a Monday, I'm 100% all right with it.
Mondays for me is good.
What day?
Monday.
Oh, Marta, you would go against me. All right. Well, we have a Monday on the table, and that Monday would be maybe the 15th of February.
The 15th is President's Day.
15th is what?
The 15th is President's Day. I'm working, but state people might have off.
Susan, you making it hard. Y'all just making it hard for me every day. All right, so all right, how about we do this? February 18th is a Thursday. I don't see anything on the calendar for me. February 18th. How does that sound for anybody? Butch, don't say anything, Butch. Don't even look at your calendar. February 18th.
Butch has group over here at Turning Point.
That's what, Marta?
Butch is doing group at 11 o'clock in Turning Point.
I don't care about you and Butch anymore. Thursday, February 18th. Are we okay with that?
It's just me, Monique, but I have meetings that day.
Oh,
but I mean, we're not going to probably be able to accommodate everybody's schedule anyway. So, I mean, but whatever we decide is fine.
Oh, I will just repeat that I was joking about the 23rd. It is World Spay Day, but it's fine to meet that day.
It's also my daughter's 4-year-old birthday.
Oh!
Yay!
All right, no one look on their personal calendars anymore. Only work calendar. I'm joking here. All right, so we have the February 18th or Tuesday, February 23rd. Either one. Can we get a vote?
I say the 23rd.
23rd.
Okay.
All right, I'm going on Tuesday, February 23rd. Can we say 11:30, same time? All right. So what we'll do is on Tuesday, February 23rd, Butch, if you don't mind sending out another reminder. I don't know how we want to meet. We want to do a Zoom, Butch. I don't think we have to state WebEx on this one.
Yeah, no. We could do Zoom or we could do Teams. Probably Zoom. I'll figure that out.
Tuesday, February 23rd, 2021 at 11:30, we'll do a Zoom or Teams meeting. I and Butch and Mary will try to finalize everything. I'll send my notes to you, Butch.
No, tired of us yet? Are you tired of us yet?
Sorry. Who said something? Oh, that was Kevin. And I'll send all this information out. Sounds good?
Sounds good.
Lovely. Thank you.
Thanks, everybody.
Thank you.
Thank you.
All right, have a good one, guys.
All right, have a good one. Thanks,
Bye.
everyone. I appreciate your input.
I got Lawrence and Zakia on the roster.
I was gonna ask you if you got everyone. So
yeah, I'm pretty sure I got everyone that came to the meeting.
Did you get Susan Carruthers? I don't think she was on in the very beginning.
She wasn't, but I got her. I have 20. I think I've got 22 people total showed up today.
Yeah,
Awesome.
There was another.
Yeah,
there was
20.
another person. I don't know if you saw it. A call-in user. I don't know who that was.
I think it might have been Lawrence.
Yeah, I've got Lawrence and I've got Zakia. I've got both of them. 20 people altogether.
Yeah, I think Lawrence may have joined via the computer and his phone, but I could be wrong.
You think that?
There is a call-in user too.
It says call. So Lawrence's name has a little mobile device next to it. I think that's a mobile device.
Yeah.
And then there's just a plain out calling.
Yeah, mobile device. Lawrence Wills.
That's him too.
Hey, Lawrence.
Yeah, Lawrence Wills.
Did you call in?
Yeah, I called in. I'm on my mobile phone.
Okay, we just wanted to check because we saw a call-in user. I think that's what happens with that when you join via your phone.
Oh, really?
Oh, it shows you twice. Okay.
Yeah, sometimes.
All right, sounds good.
Kirby, are we still using this form this year?
No,
Can you
I
also
sent out a
screen?
new one. I sent out I mean, it's the same exact form. It's just different colors and updated dates.
Okay.
But I did send out a new one. If you need me to resend it, just let me know. I'll send it out again.
So we send it to you, Amy?
Oh, it's Kirby. I'm under Amy's name.
That's Kirby.
Sorry, Kirby. Do we send that to you?
Yes. So whenever it's completed, just send it my way.
Okay, gotcha. All right,
questions.
Thank you. See you guys. Butch. See you, Butch. I'm gonna see you next month.
You see me next month.
All right. I want to say something to Bart.